Hi, welcome to today's episode of my pregnancies, Dr. Sikolia. Today we'll be talking about one very common medical problem that can happen during pregnancy, and this is a condition we call pre-eclampsia, also known as high blood pressure during pregnancy. Pre-eclampsia is high blood pressure during pregnancy. And what that means, it's high blood pressure that develops for the first time during pregnancy. So a woman has been well, they come to us, and then maybe at around 20 weeks, we measure their blood pressure and tell them, oops, your blood pressure has gone up. So if that happens for the first time during pregnancy, then that is hypertension as a result of pregnancy. Now we qualify it to be preeclampsia if we find that the same person is actually leaking a lot of proteins in urine. So we do a urine test and we find a lot of proteins in urine plus the high blood pressure, then we qualify that as preeclampsia. So preeclampsia could come in several forms. So we have what we call preeclampsia per se, and that can either be mild preeclampsia where your blood pressure is just high, maybe 140/90 to 150/100, that range, but you do not have any other symptoms. And then we have severe preeclampsia. So severe preeclampsia is when your blood pressure is high, and on top of that you have other signs of severity. So that is preeclampsia coming with severe features. So you're talking of things like severe headache, you're talking of things like pain on the right side of your chest, you're talking of things like your baby not growing well, or if you may have none of this, but if we do your blood tests, we find that your liver function is failing, your kidneys are failing, or maybe you have fluid accumulating in your lungs. So this is preeclampsia with severe features. And then we have the other extreme, what we call eclampsia. Now eclampsia is now when you have the high blood pressures, but now it's complicated by you getting seizures. So you get fits, you start convulsing. So that we call eclampsia. Then there are other variants where you may either have or not have the high blood pressure, but when we check your organs, we find that there's a problem. For instance, there is one we call HELP syndrome. So what we mean by HELP is that there is hemolysis. That means your blood is being broken down faster than it should be. There is what we call the low platelets. And the low platelets, that is a component of blood that helps with clotting. You could find that it's below the normal threshold. And then we find you may have elevated liver enzymes. So your liver is not functioning well. And in that case, those enzymes that we measure, we find that are above the normal threshold. That is HELP syndrome. So that is a spectrum of the preeclampsia disease. But there is also the aspect of hypertension in pregnancy. So not all hypertension in pregnancy is preeclampsia. So you could get hypertension either because you had it before and we did not know that you had it. The first time we see it is when you conceive. So that is, we call that pre-existing hypertension or chronic hypertension in pregnancy. Or you could have hypertension developing for the first time during pregnancy, but all the other features I mentioned of preeclampsia do not accompany it. So there is no protein in urine, the liver functions are fine, everything else is fine. We call that either gestational hypertension or pregnancy-induced hypertension. So those are the three the various aspects of hypertension disease in pregnancy. The saddest thing is that a majority of the time, preeclampsia or hypertension in pregnancy does not have any symptoms. So you come to your doctor, your midwife, perfect health, you're happy. They do your blood pressure, they tell you, oops, your blood pressure is 200/120, we need to admit you. You're like, no, but I'm feeling fine. So that is very common because most of the time you'll have no symptoms. When the symptoms start coming in, then we know that things are going south. So you may start developing symptoms when it's getting severe. So the commonest of all usually is severe headaches. People will come in with severe headaches. They may come in with the baby not moving well because it's already affecting the baby. People may come in with, you're seeing stars, you are in the room and you don't feel okay, you're seeing starring in your eyes. So those are some of the common symptoms that will first appear. But what we need to remember is that we do not have to have symptoms present to make a diagnosis of either hypertension or preeclampsia in pregnancy. There are various risk factors that could lead to a preeclampsia or put a woman at risk of getting preeclampsia. And these range from things within the history of the mother herself. For instance, she may have previous history of hypertension or preeclampsia in a previous pregnancy. That's one. First-time mothers actually more at risk of getting preeclampsia or hypertension in pregnancy compared to those who've had pregnancies before. We're looking at age, so women with advanced maternal age or very young women, so extremes of ages, could actually predispose one to preeclampsia. Women who have family history of kidney disease or heart disease, or also family history of preeclampsia. And then we are looking at women who have multiple. So if you're carrying more than one baby, then your chances of getting preeclampsia is quite high. Then other things are things like lifestyle habits, smoking, weight. All these actually could contribute to the risk of developing hypertension and preeclampsia in pregnancy. Yes, preeclampsia is life-threatening. Actually, it is among the top killers of women in this part of the world. So you're looking at sub-Saharan Africa. One of the major causes of death of women during pregnancy is preeclampsia. So preeclampsia is a life-threatening condition which should be treated as such. Yes, once you have preeclampsia, then you have more than 5-fold risk of developing preeclampsia in your subsequent pregnancy. So once it happens, then you need to look out for it, or you need to be very vigilant in your subsequent pregnancy. So we encourage women to have routine prenatal checkups, and I will be talking this in our subsequent episodes. But you should have your blood pressure checked at every clinic. And if you happen to check your blood pressure either at home or during any other event and you find it is high, and high here I'm talking about blood pressure of 140/90 and above, then you need to be seen immediately. This is not a condition where you want to wait for your next visit or for a month or so before you're seen. So this is a condition when diagnosed should be attended to immediately. If you've had preeclampsia in your previous pregnancy, the optimal waiting time we recommend is about a year. And this is for several reasons, because it helps us, first of all, confirm that it was preeclampsia, because it should go after pregnancy. Then number two, optimize your health. So there may be some modifiable risk factors that you have, maybe your health or your lifestyle, that we may want to change before you conceive. And then we may also want to give your body time to recover, because you may have suffered injury to your liver, to your kidneys, and your lungs. So we're giving time for your body to recover. So ideally you should wait at least 1 year before now you consider conceiving. There is a very interesting theory that existed, and I think still exists, about what we'll call immunity, the role of immunity in developing preeclampsia. And what was hypothesized then was that if you are with one partner, your body in essence gets used to him. and to the sperms and all that. So your body gets normalized to that state. So if you change your partner or get a new partner, then your body will be somehow hostile. So if you get your egg is fertilized and you conceive, your body could react to that, and that could lead to hostility towards that pregnancy, and in short, result into preeclampsia. So this was a theory. It's not been proven, but it's been existing for a while. So I'm not implying anything, but it is one of the theories that we do recognize as a cause of preeclampsia. There's several organizations where people can get help. You can get help from your doctors, your midwives, but importantly, I'll encourage women who've had this condition, for instance, preeclampsia, to talk to each other. And I like one particular organization, that is the Zurin Zilani Foundation, which is doing a very great job among women who have had preeclampsia. They call them survivors of preeclampsia. And they've got a forum where they meet, share stories, and I've had a lot of success stories by women just coming together at the Zuri Zilani Foundation to share experiences, share resources, and the outcomes have been very amazing. Remember, preeclampsia is preventable, preeclampsia is detectable, and preeclampsia is fatal. Any rise in blood pressure during pregnancy should be taken very seriously, because you never know when that could be preeclampsia. I hope you found today's episode on preeclampsia educative, and if you did, please leave a comment or questions in the comment section below. But also remember to like, share, and subscribe to our video. Thank you.